We have been working with Clark and his team, community providers, community mental health providers, local law enforcement, emergency management, CISM staff, to be able to come together to provide some emotional and crisis response following this event. So yesterday we started at the community center. We met with staff and students, primarily staff that were in the buildings or affected, and then we worked on devising a plan for what does our triage look like. What are we going to do today, and then what does that acute care and then long-term care look like to support the school staff and students, families, and community. So today we met with we started the day by Superintendent Wicks started the day by an address to all of the staff. We talked about what our agenda and what moving forward would look like and how we were going to provide support. So we had a team of critical incident stress management professionals. That's a national certification and training, generally meant for law enforcement officers, but that was applied for our staff today because they had been witness to a traumatic event or had been experienced that. So we had the CISM faculty staff from the state of Iowa come in and help provide that support. Teachers and staff reported that they felt very supported by being able to have opportunity to have access to that resource. From 10 to 3 today, there were about 80 staff that attended the stress management debrief. Then from 10 to 3 today, we worked with local community mental health providers and the crisis advocacy team, and we provided for staff and students some grief response. We have some materials and resources that we'll continue to provide. One thing that we really want to talk about is for parents. Parents, if you have students at home that are worried about the event, about how they're feeling, you're not sure what to expect from your child, I want you to really think about what is their typical behavior like. If you see a behavioral change, make sure you're checking in with them. Check with them frequently and often. You may have students that look really stoic and they're not having they're not crying or they're not talking about it. People grieve and respond to grief differently. What we really want to make sure that you're paying attention to is if there's any behavioral changes. Make sure you're checking on your students. There are lots of referral sources that we can get you to get additional short and long-term care.